Hi, I'm Dr. Morrison. How are you doing today? Alright, well, I'm one of the doctors here in the Cancer Genetics Clinic. Today I'm going to talk to you about the new genetic test that your prostate cancer doctor ordered for you last month. To get started, I usually like to go over a few basic concepts. A genetic test is a lab test that looks for versions of genes or parts of a person's DNA that are associated with various diseases. You had a genetic test for something called a PCA2 genetic mutation. This mutation is a specific change in what's called the PCA2 gene. The PCA2 gene is related to the body's ability to fight prostate cancer. Prostate cancer patients who have a mutation in the PCA2 gene have a higher chance of dying from their prostate cancer. What this means is that patients with the mutation might need additional treatment or more aggressive treatment than patients without the mutation. Fortunately, the PCA2 mutation is pretty rare. Only about 5% of patients have it. Your prostate cancer doctor wanted you to get tested for this mutation to help figure out your treatment options. What I want to do today is give you your results and talk about what they mean. How does that sound? Alright then. So first, I'm sorry to have to report that the test didn't turn out the way we had hoped. Unfortunately, your test was positive. In other words, it showed that you are one of the few men who does have the mutation in the PCA2 gene. So let me give you a few details about your test results. What a positive PCA2 test result means is that your risk of dying from your prostate cancer is increased. The average patient without the mutation has a 15% risk. However, studies show that patients like you who have the mutation have a 40% risk. Just to be clear, your risk of dying from your prostate cancer is higher than average. Your risk is 40%, and the average patient's risk is 15%. What your risk estimate is based on is studies of prostate cancer patients who are similar to you. So, if we took 100 people with the same genetic test results as you, we would expect about 40 of them to die from their prostate cancer. Of course, we can't predict exactly what will happen to any one person, but your risk estimate tells us what your overall chances are. It's concrete information that can help you decide what path to take. So this gives us something to work with. Before this genetic test was developed, there really wasn't a good way to accurately predict someone's chances of dying from prostate cancer. But now, medical science has finally advanced to the point where we can do that. So we're not in the dark anymore. We have a good sense of what your risk really is and what to expect in the future. Okay, before I go further, I just want to check with you. Do you feel like you understand what your test results mean when it comes to your risk of dying from prostate cancer?